Making sure we're live on Facebook. Okay, we are live. Welcome to Lurie Children's Facebook Live, Return to School for Youth with Special Healthcare Needs, Key Questions and Considerations for Families. I'm Julianne Bardaly, the Social Media Manager at Lurie Children's, and we have a special guest panel today that I'd like to take some time to introduce. First, we have Dr. Carolyn Foster. Dr. Foster is an assistant professor of pediatrics at Northwestern University Feinberg School of Medicine and an attending physician at Lurie Children's in primary care. As a physician and investigator, she focuses on developing and evaluating healthcare delivery interventions for children with medical complexity that maximize their health outcomes and optimizes their healthcare utilization within a family context. She's particularly interested in improving the access to the quality of home and community-based healthcare for children needed for safe, independent, and vibrant lives at home, school, and play. Then next we have Dr. Ami Patel. Dr. Patel is an infectious disease physician and a faculty member in the Division of Infectious Diseases at Lurie Children's. Dr. Patel also serves as one of our medical directors for the Infection Prevention and Control Program at Lurie Children's. And then lastly, we have our special guest host and moderator today, Margaret Story. Margaret is a professor of history and associate dean of the College of Liberal Arts and Sciences at DePaul University. As a parent advocate for children with medical complexity and disabilities, she serves on the board of directors for the Danny Didd Foundation, the Family Advisory Board, and Public Advocacy and Community Engagement Committee at Lurie Children's, and the Pediatric Epilepsy Learning Health Systems Community Core of Weill Cornell Medicine in New York. I'd like to take just a moment to let our viewers know that this is a live broadcast. We'd love for their participation. So if you have questions during our discussion, please make sure you ask them in the comments below. We'll do our best to answer them live during our broadcast, but if we don't, we'll do some follow-up after we end the live broadcast. So we have a lot to discuss, and I thank our panelists for being part of this today. And Margaret, thank you for being our special guest moderator. I'm going to hand this over to you, and we'll get started.
It's great. Thanks so much, Julianne. And hi, everybody. It's really nice to have you with us today. As they said, my name's Margaret Story, and my daughter Josie is 17. She has medical complexity, condition called Aicardi syndrome, which is a syndrome of epilepsy. And this conversation today is something that's very close to my heart, and I think is going to come at a really important time for a lot of families like ours. And I just want to thank Lurie Children's for hosting us and for taking the time to talk through these issues. It's really such an important conversation. And I should just say that the goal of our discussion today is really just to help empower families and caregivers to have the conversations with their pediatricians and specialists and with school personnel so that you know the kinds of questions you can ask, you can be informed when you ask those questions, and get the kinds of supports and information you need to make the best decision for your family. Dr. Patel, do you want to add anything else about just our general considerations as we go forward in the conversation?
Yes, thank you. And thank you for including me in this discussion of a very important topic. I think it's important for everyone and for us to remember that since this pandemic has started, we've learned a lot about the virus in the past few months, but there's still a lot of information that we don't know and that we are still learning and gathering data to kind of help us guide families and parents. So I think a lot of what we discuss is based on what we know at this point in time, and we use that and kind of use what we know to help guide families. So many of the discussions that we have with parents with decisions such as these going back to school are really considerations for families to take into account, or a framework to think about what return to school may look like, and evaluating and balancing different risks or consideration for their families. I think there's not one right answer, one perfect answer. And sometimes we aren't able to provide specific guidance because risk really varies by region, by school, by family, and over time as the epidemiology of this disease evolves or changes. I think it really requires consideration and conversation for each individual child and their individual risk. There are factors and considerations that impact how families approach this. It's very family specific, family factors, school factors, and community factors. One thing that's important to remember is that often what we see and what we learn is from the news or the media or certain stories or literature that often speak to national trends. So it's very important for families to educate themselves and learn about what is happening locally in their community, because that will affect how they approach their decisions. So I think the overall goal is offer thoughts and considerations to guide each individual family's decision making and how to think about learning to school. And also it's important to remember that guidance is being revised and adjusted. So as we learn more, families take that into consideration too as time goes on.
That's really, really helpful. And I think, a lot of our families are used to having to adjust their expectations on a rolling basis. And this is one where maybe the adjustments just have to be a lot faster. And so that's our goal, is to just equip you with as much as we understand right now so that you can go out there and make the decisions that are right for your family. So let's get cracking. I'm going to ask the first question for Dr. Patel. So a question at the top of mind for a lot of us is just, what is an underlying condition that might put one of our children at higher risk, either for acquiring COVID-19 or for complications related to it?
Yeah, so since this pandemic has started and as the disease has evolved, we started to learn a little bit about who may be at more risk for either severe illness or complications or poor outcomes. But overall, there's still limited data, especially for pediatrics and children. And it's not known if children with underlying conditions are more at risk in general from COVID-19, but there is some data of children who require hospitalization or intensive care unit care, which could be a marker, of more severe illness or complications. Based on what we know at this time, the CDC has listed certain conditions, and a lot of this comes from adult data, but they've divided some conditions to what they describe as conditions that are at increased risk for severe illness. So that would be underlying lung disease or heart disease, diabetes, obesity, cancer. And then there's also a group that they've listed that might be at increased risk from what we know about these conditions in general. So that could be asthma or underlying neurological conditions. Thinking about literature, there's been a few studies specific to children, but also with smaller numbers and little bit of data. For example, there was a study early on. It was an early description looking at the first couple of months of the pandemic and specifically children requiring ICU care. And they had noted that this study and other studies that kind of look at general epidemiology, that there's a vast majority of children requiring hospitalization have some type of underlying condition, maybe over half, over 3/4. It varies based on the study and the specific factors that they were looking at. The ICU study in particular noted medical complexity in children and found 40% of their children were medically complex, and they defined that as being technology dependent, requiring devices such as a tracheostomy or gastrostomy tube, developmental delay, or genetic anomalies. I think it's important to note that children with special needs or that are medically complex in general are thought to be more at risk for respiratory illness in general, and that therefore that may be to COVID-19 as well. But we don't know for sure the effects of COVID-19 and need a little bit more information specific to that. And another point is that children with underlying conditions may be at risk from any illness in general. For example, children with neurological conditions, anything that could cause a fever may exacerbate the underlying illness or may perhaps lead to more seizures and make their underlying neurological disease worse. I think what we don't have information for, or perhaps it's a little bit unclear just yet, does COVID-19 exacerbate the underlying condition? Is that risk any higher with COVID-19 than any other illness in general?
Great. Thanks so much. What do we know about COVID-19 and certain types of treatments or protocols? This might include nebulizers, suctioning, nutrition pumps. Are there any special considerations that families should be aware of?
So this is a good question. And it kind of gets to the question about how this virus is spread. So the way that the virus that causes COVID-19 is spread is mainly between people through the respiratory route or the respiratory mode. So respiratory droplets when a person is coughing or sneezing or talking. And there's certain respiratory regimens, like you mentioned, such as nebulizers or perhaps suctioning or a vest that's intended to make somebody cough, that's thought to increase spread. But if that person receiving the treatments is actually infected. So children receiving complex regimens such as this, it may put them more at risk of spreading the virus just from the instrumentation that you're doing of the nose or the mouth or that cough reflex. But I think it's important to note that when we discuss these respiratory modalities, children that require these therapies, it doesn't necessarily make them more at risk because they need these therapies. That's not the reason that puts them more at risk, but rather it's more the viewpoint of spreading the virus should the child requiring these therapies be infected. But it also goes back to the point that children that require these therapies often have an underlying condition, and we have to think about risk with that condition as well. And some considerations specifically to think about that parents can consider, if a child is using a nebulizer, can they speak to their pediatrician and is an inhaler option, an alternative option for them? And it could depend on the medication they're using. Timing for some of these therapies, is it something that has to be done at school based on how often they need it, or can something be adjusted and it could be occur at home? And also talking to schools about how some of these procedures can be done safely for everyone. So including the child getting them, the other children in the classroom, and the teachers and other staff. Perhaps there's a separate room to perform some of these treatments. And to address one of the specific modalities you talked about, nutrition pumps or medication administration in general, those aren't, in my mind, considered to be high risk for spreading the virus, primarily because the driver primarily is the respiratory tract. So a nutrition pump or G-tube feeding doesn't increase that risk. So schools should continue using their routine feeding and cleaning protocols for those types of treatments.
Super. That's great. We also recently saw that there was a Lui study, and I think you were part of the study, about high levels of viral load among children. And these are children who tested positive for COVID-19. So could you explain a little bit about what we learned from that study, what we didn't learn from that study, and what implications might be for our kids, if any?
Yeah, I can speak to that a little bit. So the group of us that worked on this study, what we noticed was when we were testing children, that younger children tend to have a higher amount of virus in their specimens. The way at our institution we run the test, we use a PCR-based test from a nasal specimen, which essentially detects the nucleic acid of the virus. And when we looked at our tests in particular, we noticed that there were higher levels of that nucleic acid, or you could think of it as a higher viral load in some of the younger children compared to adults or even some older children. So essentially, it was just a measure of the amount of virus. And what the study doesn't specifically tell us is about how these children were clinically impacted based on the varying viral loads that we found, or how this is related to transmission. So in fact, the amount of virus in the child's nose didn't always clinically correlate with how sick that child would be. So the highest amount of virus weren't necessarily the sickest kids. Some had a mild illness or perhaps a fever. And it's also important to note that what was not studied and what the study doesn't tell us was how that amount of virus found correlates to transmission. How the viral load relates to transmission just wasn't evaluated. And that's a good example of some of the things I was discussing earlier of what we don't know yet.
I think it really is a great example of just we're getting incremental knowledge over time, and we just have to constantly, kind of keep ourselves up to date. Thanks so much. It's really helpful. Dr. Oster, I'm turning to you now. How would you advise families to approach decision making regarding school? You talk to families a lot about these questions, I'm sure, and we would really just love to hear from you how you think we should approach those conversations. How should we inform ourselves? How should we help our families make the decisions we need to make?
Thanks, Margaret. I think it's a really important question, and you're right. It's absolutely coming up, I think, for many pediatricians. I think it might be helpful first to think of it potentially as a series of conversations and data gathering to make a decision with, as what you've already noted, it may be a decision that has to be amended over time as things may change depending on what happens with schools opening. But I certainly would emphasize the importance of speaking to your primary care pediatrician or whomever you identify as a primary specialist or multiple specialists who help you make decisions about your child's care. And part of that conversation is talking through out loud in a kind of a shared decision-making model. Well, what are the particular medical conditions and risks for my child that may or may not put them at risk? Dr. Patel referred to those. And then what are the specific considerations for my child developmentally based either on their age or, their own behavioral, developmental, neurologic capacities that allow them to optimize, to gain benefit from in-person education. Certainly, I think many of us are aware that children receiving therapies in school, one-on-one instruction in school, that may not be as amenable to remote care. And so it's really a conversation like many of the ones we make with our physicians around risk benefit. There's a certain risk to exposure, and there's obviously a risk to loss of educational benefit. And I think to some degree, all families are having this conversation, but I think certainly for children with medical complexity or special healthcare needs, there are these added considerations of additional risk to the child, both of their medical condition, but also their potential for loss of benefit from not being in school. I would also encourage them to reach out to the school to understand what limitations the school is potentially proposing to them, to make sure they're bringing it back to the school, to their pediatrician to discuss that. And I think Dr. Patel gave an example. If the school's trying to work through how they're going to handle nebulizers, and you can talk to your pediatrician about, they'll accommodate me, but I think it might remove my child from the classroom sufficiently enough that I don't want to do that. Can we think about switching to a MDI or inhaler? I'd like to try that. Trying that sooner than later, so trying that regimen at home before they return to school is ideal because you want to make sure it works. And then I would also say, don't be shy about asking your pediatrician to join in a conversation with the school. It obviously can be sometimes frustrating or difficult to arrange them, but I really personally believe it's part of our role to be there for that, if at all possible, to help bridge some of the school's concerns potentially about a return to school, and also be there really frankly to support the parent in those conversations.
We actually have sorry to interject, but a question from a teacher. So this seemed like an appropriate time to ask for her. Her name's Jessica. She says, students with special needs attending school in small groups will enter my school building. And she's just asking what PPE is essential for the nurse when she's accessing these students with COVID-like symptoms to protect both themselves and other students from cross-contamination. Is there a best practice at this current time that you would recommend? She wants to be sure she protects all of her students and herself in attendance.
So I think I can start. One of the most critical, I think, ways that we have of protecting ourselves and others during this is a face mask. So wearing a face mask or a surgical mask during these times, I think will protect the children from any type of exposure, but depending on the type of mask can also protect the nurse as well. And thinking about what needs to be done during these interactions, if it's assessment for medication administration, it's thought to be potentially lower risk, but if there's other procedures that need to be done, such as a nebulizer administration, or if it's suctioning or things like that, additional layers of protection in terms of PPE should be considered. So for example, in the hospital, all of the staff and healthcare workers here wear masks, but whenever we see patients or families, both in the inpatient and outpatient setting, we also add eye protection to that as well. And it's important to note that sometimes your personal glasses don't necessarily count as that, or so having a dedicated eye protection or shield. And depending on the situation and what the school has for resources and what they use. If there's anticipated to have a lot of bodily fluid contact or the need for the assessment, does there need to be additional protection? Should she put on some gloves or should she put on some gown? I think some of that depends on what that assessment for that particular child requires.
Thank you.
Great. So, Dr. Foster, as you know, a lot of us provide essential care for our children. This is care that enables our children to live at home with us. Sometimes we are single parents doing that work. Sometimes even if we're in a dual parent household, we don't have extra layers of family to help us in the event that we are unable to provide care. So I think it's a consideration maybe that isn't typical for other families to make, but it's really important for our families to understand how we have to consider the risk to the caregiver of the circumstance. Understanding that even if a child is not made ill by COVID-19, if a parent or caregiver is made ill, that the child may be at risk for other kinds of complications because the main caregiver or caregivers are not able to take care of that child. So how do you help us think that through?
I really appreciate this question, Margaret, and I've actually had these conversations with some of my patients' families already. So I think the question's spot on. And actually, this reminds me to plug that the Illinois Department of Specialized Care for Children, the DSCC, will be putting out a newsletter with a little even more extended answer to this question over the next month, talking about more expanded things like guardianship. So a little plug for that newsletter. But you know, I'm going to give an answer humbly because I recognize the amount of energy and time families put in already to planning and thinking through their child's care. And so it would start with acknowledging that the family situation is part of the risk-benefit ratio discussion about whether a child should return to school. And I think you're calling out a reality for some families that it may weigh a little heavier on being protective and being at home because of the potential risk for a caregiver getting ill. And I think what you're speaking to is that unfortunately, sometimes not just any babysitter can come over and care for a child, depending on what their medical regimen is. So to whatever degree a family can think about identifying one or more backup caregivers who have a real, meaningful conversation about if I were or other caregivers at home were to get ill, would it be possible or what would it look like for you to be able to step in? And thinking through, can you come over, meet my child, if they're not already a family member who knows them well, run through a day or two of what a regimen of a day in the life looks like, caring for the kid, giving the medications, et cetera, knowing how to respond if a seizure happens so that everybody's comfortable, and especially that the child knows the person. And I recognize not everybody has extended family where they live. So really thinking creatively within one's faith community. I think, Margaret, you had pointed out to me the idea of thinking about paraprofessionals and other school personnel who know your child well, who would maybe potentially be open to that. And I think it's really, frankly, a type of disaster planning. And we really should, frankly, be thinking about this for children with medical complexity in particular at all times. I think COVID has just brought it to our fore a little bit more than it would have historically. And part of this planning is also having a written care plan available with basics such as medications, daily treatments, including like the child's schedule and allergies. And again, also thinking through, are there supplies or refills that I could have on hand that if I or someone else was sick for 2 to 3 weeks, we would have what we needed. That I think would be helpful. And then I think the last piece of this is thinking through the physical setup of your home and thinking through, gosh, if we're going to have to quarantine one or more family members, what would that look like? So a lot of this is kind of, I would say, intellectual work of planning, which I know a lot of families do already. But I would really encourage parents to do that if they can. And then I think the last piece is if you're really finding like, I can't identify a caregiver, have a conversation with a pediatrician of like, gosh, what would it look like? Most states have options for, I think kind of the worst case scenario is acute hospitalization, which I think we try to avoid. We want to keep people home if we can. but there are opportunities for short-term or long-term respite. And sometimes it takes a little time for a pediatrician to identify the resources in their area. But man, having that list of like, this is where we could go if we don't have a backup caregiver should be thought through. We certainly have some of those options in the Chicago area, and it's something to think about as well.
I think it's really important. Many families don't anticipate needing that resource and may never have had that conversation. Some families have had that conversation and have taken advantage of those options in other circumstances. But for those of us who have not, this might really be the right time to explore those options, understand what's available so that you really can have that backup plan in place. And this is just a way to control the little bit that we can control so that we have less anxiety and less stress about the unknown, right? And that's an important piece of this, I think.
Thanks, Margaret. And you're reminding me, because I know what I'm describing is work. It takes time to put together a care plan. If you don't already have a care coordinator that works with your family, think about whether it's with your pediatrician or probably more realistically where your child might get specialty care at a children's hospital. Otherwise, there are often care coordinators either through a medically complex care clinic or through the larger hospital organization who may help you be able to sit down and write a care plan and may even have a template available. We can also provide a link, I'm realizing now, potentially would be helpful about some templates for care plans for families. That would be
really super. That would be super. And I would also say, don't forget about social work.
Yes.
A school social workers can also put you in touch. Often your specialty clinic will have a social worker. Be in touch with those folks as helpers in this situation, for sure. Right?
Yeah, thanks.
Okay. So this is a big question for a lot of families. How do we approach masking for children who may be developmentally struggling with that or have anatomical differences that make typical masking challenging?
Yeah, this is a big one. And I'll start, and I'm sure, Dr. Patel, if you want to jump in after I've given because you certainly have a lot of expertise in this area. So I think the first thing I want to emphasize for everyone is for those who can wear masks, please wear masks. It's important to do so because there are going to be a small proportion of children who can't. And I really believe it's our responsibility to do so in order to protect the children who are not going to be able to, and also to enable us in general to minimize the spread. There are going to be children who are just kind of generally uncomfortable with wearing it. And there are ways to work through practice and play with that. In particular, there are children who may be having developmental behavioral differences. I think one that comes to mind maybe are children with sensory challenges, perhaps autism, who it's less about the physical placement of the mask over their anatomy and more about their ability to cope with the mask being placed, which is completely understandable. We are going to have a link, I believe, to a great video from the Child Neurology Foundation that gives tips on how to work through with those children or other children with neurologic differences, how to try to get the best we can with the mask, knowing that for some children, it just may not be feasible. Some considerations are trying different kinds of masks that may have different feelings, itchy versus not, so surgical versus cloth, with the idea that something's better than nothing, and thinking about different strategies for how to put it behind and secure it, whether behind the ear or around tying it around the head instead of the tight bands around the ear. So depending on the child's needs, those are some tips to think about. And the last, of course, are children who may have anatomic differences who really cannot wear a mask, whether they have a tracheostomy or some other craniofacial difference. For those kids in particular, I would really suggest discussing that with your specialty physician. They have considerations around technology, what might be able to be added to a trach, removed from a trach, around the technology that would be thoughtful. And the reality is there are going to be some kids it's just not feasible. And I think, Dr. Patel, you had pointed out a great way of phrasing it for me, which is that we want people to wear masks, but for those who can't, then think secondarily about the layers of protection around that child, making sure to still do the distancing, et cetera. And then, Dr. Patel, do you want to maybe comment? I'm going to ping it to you about the new advice that came out, I think it was yesterday, the day before, at least for Illinois, around masking for kids at school.
Yeah, there was just some new guidance yesterday distributed specifically from the Illinois Department of Public Health, speaking to young children and wearing masks and young children attending school with masks. And I want to echo what Dr. Foster said about anyone that can wear a mask should absolutely try their best to wear one to minimize spread to others and to protect themselves as well. I think a couple of notable differences or exceptions are anyone under 2 is not required to wear a mask, and anyone that just developmentally perhaps is not able to take the mask off. So thinking of children under 2 or those children who developmentally aren't able to take it off if they're in need of doing so should not be required to wear a mask. And I think it's important to note that these children should speak to their schools. They should be, when they're going to school, and if they're unable to wear a mask for specific reasons, then thinking about putting emphasis on other measures of protection. So could they utilize a face shield as well, acknowledging that this isn't a perfect substitute for a mask that covers the nose and mouth and won't reduce risk as much, but as Dr. Foster pointed out, this is, adding some protection and perhaps putting more emphasis on social distancing for those children, hand washing, things like that.
And one other thing I was going to point out about the masking piece was it's pretty clear, especially in the written guidance that we just got for Illinois, but I think in general, that a child not wearing a mask should not preclude them from attending in-person education. Because of these other layers of protection, that particular, oh, my child can't wear a mask, shouldn't be used as a way of keeping a child from the option of in-person education if that's the right thing for that child.
Yeah, and it's worth a conversation with the school or the pediatrician or the subspecialist cares of other approaches for that child that could be helpful, or a plan at school for that individual child in that specific circumstance.
We actually do have a question from a viewer in regards to masking, and she recognizes, and she works in a school, that students, there will be some that just cannot wear one. And is there anything in addition that the school nurses or staff can do in terms of the protection that they wear? I know we talked about a little bit about this before, but can you reiterate that, Dr. Padel?
So I think there's an important distinction between the children that aren't able to wear it because of their age or because of their underlying medical condition or perhaps behavioral conditions. And then also the distinction between children being children, right? Expecting them to keep it on without a few reminders here or there, having that knowledge or thinking of why they need to keep that on. I think this goes back to the point that Dr. Foster made of anyone that can wear it should be encouraged to wear it as much as they can to reduce risk for everyone. I think gentle reminders for children, what Dr. Foster said about kind of practicing with children and trying to normalize it as part of their day as much as possible. This will be a part of our lives, I think, for the very near and distant future. So trying to incorporate it as much as possible through practice or, medical play and stuffed animals. Or I think it's important to show children, sometimes they get perhaps a little afraid because you can't see the face. So kind of showing them it's me, the family, or the teacher behind the mask, and then kind of putting it back on to help that make that association as well. I think there's some helpful strategies. I don't know if Margaret from personal experience or Dr. Foster, if you have other strategies as well that could help.
Well, one thing, and forgive me, y'all, if it's really loud, there's just lawn mowing happen out there. And you know how this is in Zoom land. You do the best you can, and then, talk about being out of control of circumstances. But I will say this, that I think it's important not to underestimate our children. And I've learned that from Miss Josie, who I was quite sure would not wear a mask. And we worked with different types. She definitely does better with one that ties on. And if it is not really too big, it fits really well. It's not too tight, and it's a cloth mask. So the paper masks don't suit her. But I have had luck putting the paper mask over the cloth mask when at the clinic, when that's been a request of the clinic. And, just talking to her about, look, mama's got it on. We've all got it on. We all have to do it. It's important. And she is on board. It's taken a little bit of practice, but I think we shouldn't underestimate our kids. I think the challenge is going to be how long they can tolerate it. And so I think thinking through a schedule of breaks where it's safe to be in a break situation, to give the opportunity to take breathers from it, to practice at home under non-stressful circumstances, to all those kinds of things that make it something that's normative and safe, and that they know they can, in fact, get it off, that it can be removed. And I think that's probably really important psychologically. It's just, we all know that we can talk ourselves into a place of being okay with that. But that's not necessarily the self-talk that all of our kids are able to do for themselves. And so I think being prepared for that to need to be short-term duration of the mask and then being able to take a break is probably important. Julianne, are there any other questions?
There is, and I think this is a good one. It's multiple questions, and so we'll take some time to answer this. It's from Lauren, and she's asking, can you tell us about the best practices for siblings of medically complex children? Are there special considerations we should look for in terms of school precautions when thinking about sending them back in person, and then precautions at home? So it's a big question. We can take it in parts, but wants to answer that. Yeah.
Start. I think this question has been brought to me and my colleagues, I think frequently thinking about siblings of any child, whether it's a medically complex or somebody with underlying conditions, and how to think through that piece of sending a sibling back to school in addition to a child with underlying condition, or if the decision has been made to keep to virtually teach the medically complex or child with underlying condition, should the sibling go back to school. And I think it's important to kind of explain what is going on to the child and the sibling that's going to school, so they have an understanding of what is going on and how this affects themselves and the family, and how things might look a little bit different than going back to school maybe previously. It's important that the siblings in particular are also very attentive and following the same infection prevention, the same risk mitigation principles that we speak about for the medically complex or special needs child as well, so that when they're at school, they're able to decrease their risk of contracting the virus. So, being attentive to wearing their mask, frequently washing or cleaning their hands, and maintaining their distance. One question that often comes up is what to think about when the siblings are coming home from school, and should there be something that's done at school that can help reduce some of the risks. I think some of those basic principles of preventing infections or transmission that we widely talk about now are so very important. Hand washing is critical and very important when children are coming home from school or elsewhere when they're coming back home. Before and after eating or using the bathroom is very important. I think parents being vigilant at home about monitoring their children for symptoms. I think parents are very vigilant with their children, but during this time thinking about, is anyone starting to get sick or becoming sick? And if that's the case, then those are children that should not be going to school. Cleaning the home in terms of, we talk about high touch surfaces at home to kind of wipe down things like doorknobs or switches or handles, countertops, or like our phones and screens are things that we all touch very frequently these days. With children, trying our best to avoid some very personal or shared items, cups or utensils, the best that we can. And the question has come up about distancing at home as well. I think that's a tough question and a tough almost expectation for families to distance from each other at home, or children to not want to play with their siblings and interact with them. But some of the families I've spoken to have approached this different ways in how they choose to do that or not, in terms of distancing at home, or trying to use separate rooms or bathrooms. And I think this varies by age and varies by the needs of the child as well. And one important point to discuss when we think about exposures or balancing risks, we have all kind of seen and heard the term bubbles now during this pandemic, like who is in our bubble. So oftentimes that could be just our immediate family, or interacting with grandparents, or some families choose another family that they know and trust, or that they uh, made that decision that they would be interacting with that family. And when we have different children or school siblings going to school, it's kind of in a way expanding that bubble. So now it's not just the family that you're at home with, or the grandparents that you're seeing, or the one family that you're used to interacting with during the pandemic. We're now expanding it to this one school or this one classroom as well. Or if siblings are starting to participate on other activities or sports, it's kind of another bubble. And it's something for families and parents to consider of who we're interacting with and who we're contacting with. And if, we're expanding our bubble one way, should we think about minimizing risk or exposure another way? And that's also a very kind of personal and individual decision based on each family's unique circumstances and situation.
I think it's really helpful to think about the multiple bubbles and start to balance out, which bubbles are a priority and why, and thinking that through. It's not that we're afraid. It's just a simple logical analysis of the number of contacts that you may have, and we just have. It's a question of just thinking it through. And I don't think anyone should feel bad about wanting to pull a bubble back. And I think we should feel free to say, for us, this is just what is the right thing to do, and not feel like that somehow you're not, trusting your friends or whatever. It is just really a question of thinking through priorities. And if school is the priority, then that seems to be something that you can commit to, right? And other things might be less of a priority in that context. So another really important question, Dr. Foster, what should we do regarding other vaccines during this time, especially the flu vaccine?
Thanks for that question. A favorite question of pediatricians. So I will emphasize to please prioritize getting vaccinated, and especially not delaying the flu vaccine. We think it's even more important this year, and really getting to the points that Dr. Patel made earlier about the reality is for children with special healthcare needs or medical complexity, any significant viral-respiratory illness puts them at risk for hospitalization, emergency room use, intensive care. And to not, just because we know COVID's around, be complacent about the flu vaccine. And certainly our other routine vaccines as well. We do know there has been some decline in the ability for people to get their routine vaccines. And we strongly encourage you to reach out to your pediatrician's office about getting those completed. I would be very disappointed if we had outbreaks of other diseases while we're trying to manage COVID. I think many of us feel like that would be a real loss, and really concerning. And kind of getting to the point earlier about why it's important for people to mask, because a few can't. It's same goes for vaccination. For those of us who can be vaccinated, we really should be. We need to protect the people for whatever their medical reasons can't be. I also want to acknowledge that some parents have brought up to me, and I've even had the conversation with some of my patients' parents about their fears of coming into the office to get that vaccine. And I have discussed at length, and I think you should do the same, talking to your pediatrician about how they've altered their physical space or other protocols to maximize the safety of you going in. There has been a lot of work in that area. And if you don't know that yet, don't just assume that the pediatrician's office is the same as going to the grocery store. I really don't believe that they are safe places to go get care. And if you have particular concerns that have to do with your child's medical condition, I know that pediatricians are really doing everything they can to accommodate. So the summary is do it, and talk to your pediatrician if you have concerns for any reason.
Absolutely, that's great. Julianne, any other questions coming through there?
No, we are good.
Okay.
Well,
great.
Margaret, I think one thing that as the parent we want to ask you is how should parents be thinking about next steps for consulting their school personnel around a return to school?
Well, again, this is going to vary a lot by your circumstance and the nature of the relationship you already have. But the first thing is to have the conversation with the physicians, so that when you approach school, you understand real clearly what the parameters are for the care of your child in this circumstance. You've kind of updated your own assessment of care planning for the child, so that when you go to school, you can say, in consultation with our doctors, these are the things that we're going to be emphasizing, or these are our concerns, or these are the needs we have. And it's that kind of informed, team-based approach that I think works the best when talking about how to maybe change accommodations if you're going to go face-to-face again, or to think about the other options if you are going to stay remote, and how you might meet the needs of the IEP or the 504 under those circumstances. And this, again, it's going to be highly individualized, but the earlier you have a conversation, the better. With more information on your side, the better. And with patience. Because I do think that what some of our schools are facing by way of having to kind of think through a whole huge assortment of contingencies is pretty big. And I think if we work together patiently, that we're going to get down the road in the way that we need to. At the same time, you know who your advocates are if that's not happening. And I think that everyone has the resources that they need at hand. And if you don't, talk to that social worker again. Reach out to back to your physician to say that you're struggling to have this kind of come together to see what you can do and what your next steps are. Always asking for help, asking for questions, relying on fellow parents, our fellow travelers who've gone the road before and always have great resources for us.
Thank you. I really appreciate that. And I think one thing parents have pointed out to me is the importance of a paper trail, keeping track of the times you've reached out and communicated, so that it's not, you can say, look, I've reached out these dates and I haven't heard back. And I want to again emphasize a point you just made, which is that your pediatrician is really here to help advocate for you. And I actually, so far in some of our communications with schools, agree with your point that they're actually somewhat hungry for some medical input about how best to achieve that. And that's why either having the conversation with your pediatrician ahead of time or including your pediatrician may be beneficial, depending on the circumstances. If there's a lack of clarity from the school, like we're not actually sure how to best help accommodate your child, that's what we're here for.
Yeah, absolutely.
We had a couple questions from viewers regarding concerns about children who have had major procedures recently in the last month or 2 weeks, and what that outlook for going back to school would look like. And I think this is what you guys are talking about, is having those conversations directly with that child's healthcare team. But if you care to expand or share more, please do.
Yeah, I think that's a good point. I think if the family and the child should have a conversation with the pediatrician or the specialist, as well as the school, to kind of discuss the procedure the child may have, certain considerations from this procedure that might be a little different from what would be typically expected, or other additional medications or needs that are required because of the procedure. I think it depends on the child and the actual procedure that was done. So I think it'd be very important to talk to the physicians, the pediatrician, the specialist in the school to help make a plan of how to approach school for this particular child.
Right. It's not a one size fits all.
No.
Each case needs to be decided on individually and with those who are your healthcare providers.
And I would just say, though, that it's smart to say to yourself, in normal times, I would know exactly how to manage this. Mm-hmm. But now maybe I need to step back and say, are my normal plans really going to roll easily under these new circumstances? So just not assuming that normal business can always be conducted in the way we expect. And we need to just plan a little bit more than we would maybe otherwise do.
That's a great point, especially as it relates to communicating about, I know often the pediatrician or specialist has to sign a form to say a child could take a medication to school. Mm-hmm. So if a procedure is leading to a difference in regimen, doing that earlier than later and figuring out how to communicate that to school might be a little different than what we did before if you were sending in person. So, and I very much agree with Dr. Patel's point that really depends on the procedure and what the recovery might be. So it's all about conversations with the healthcare team.
Another question from a viewer, and we've discussed this before, but I think it's a question on everyone's mind, is, children who can't wear masks, and is it safe to return to school? What measures can be taken to help prevent the spread of COVID or others from getting COVID?
So I think this comes back to some of the points that Dr. Foster and we've discussed about evaluating and kind of balancing that level of risk and the benefit of in-person learning for that particular child and the reason that they're unable to wear a mask. I think it also goes back to conversations about within the family of making a decision of how they want to approach this if their child is unable to wear a mask. It's one critical piece in protecting during this pandemic, but there's other factors and layers, like Dr. Foster said, of protection. So if there's a child that simply isn't able to wear a mask, other considerations we can make, such as a face shield or placing additional emphasis on other preventative measures, especially that distancing part. And I think that for each child that isn't able to wear a mask, the factors to think about going to school really will hinge on a conversation with the school of what their classroom may look like, potentially the risk or factors to consider of other children in that classroom versus factors of other family members at home, and locally what's going on in the community in terms of epidemiology and the number of cases and the risk of contracting the virus that way. So I think those are all kind of different viewpoints to think about for that particular child, in addition to them not being able to wear a mask.
And one thing I think it's important to do is, and when you're talking to school personnel, is understand if there's a sort of hybrid model where there's some students who are going to go remote and some who go face to face, understanding what the timelines are for making a choice about that, whether you can try remote for a period and then at some point in the year elect to go face to face, what the timings would be, understand those timelines and when those choices and decisions need to be made, and what the consequences are if you change your mind, if you're able to change your mind, if you go face to face and then decide to go remote. So being aware of all of those timelines can also help you decide if you want to enter the stream at a certain point or want to have a little test period. All of those things are part and parcel of the decision making, it seems to me.
I think that's a really great point, Margaret. And actually, I would even go a step further to say, for those of you who are going to be having conversations about your IEP and 504, and you're hoping to, you're currently making a decision to send your child in person, you should actually think through with your IEP team, what will it look like if the school has to or decides to end up going remote for everybody? We don't have a choice here anymore, because it would be a shame to have brought all those people together to have the conversation and not thought through the backup plan, which in whatever direction. I really appreciate you highlighting that. I think it's a really important point.
We have another question from a viewer, and Dr. Patel, you touched on this at the beginning of our broadcast about how important it is to look at the local community data on COVID. And this mom is asking, is there a positivity rate at which you would recommend not attending in person? Can you talk a little bit about what that means in terms of the spread of COVID?
So that's a good question. And this kind of goes back to us still learning about the virus and how it's affecting our communities and our children. So there isn't one specific positivity rate or one specific metric that the public health team or infectious diseases team or even school boards that know of that we've decided upon or even think about as being related to increased risk or decreased risk. So I think it's difficult to say one specific positivity rate of how to approach return to school or hybrid models or virtual learning. I think knowing what's going on at the school is just as important as what's going on in the local community, and having conversations, especially if there's a change, like if there's increasing rates or positivity that's being seen in your region or community or even in your school, and how that may affect your thinking.
The only thing I would add to that is just as a family, our family, I mean, we tend to be pretty conservative on this, but I would suggest that that question of the bubbles, it comes up. If the positivity rate is higher, maybe the bubbles are fewer. Thinking about, again, what your priority is. If school's a priority, then minimizing contacts in other ways may allow you to do that, even if there is a higher positivity rate than you wish. At the same time, listen to the best science that's out there. It's the best that we understand, and take seriously educating yourself as much as possible what we're seeing happen in other places, and ask your doctor, help me interpret what I'm seeing happening in this context or that context vis-a-vis ours. How does this particular scenario that I read about happening at a university, for instance, help me understand what's going to happen in my public school? I need to know what the relationship is between those, and having those conversations with your doctor, I think, can be really helpful because it's very specific. And as we know, what happens here is not necessarily what happens there, but they can inform each other, and we can understand things more deeply by analogy.
Well, I think we've almost reached an hour, so I don't know if you guys want to have some closing thoughts or points you'd like to make, but I think it was a great discussion.
My only point would just be good luck with everything, everybody. Take it easy on yourself. This is hard work right now. I know so many families, so many caregivers who do amazing work every single day with their children. Just unbelievable commitment. And gonna get a little choked up. This has been difficult for a lot of us, and I know that. And I just want to say you're my heroes because I know how hard you're all working. That's it. Sorry.
No, that's wonderful, Margaret. I think it's real and we appreciate it. And that's why it's so important to have a family perspective in these conversations. I think I was similarly going to acknowledge the challenge of the uncertainty we're all facing. And I think, I think all of us would love to be able to give everybody specific, concrete answers to everything. And we recognize that in many ways, what we're providing was a framework for how to have these conversations. I'm biased as a primary care physician that having a long-term relationship with physicians who know your child and who know your family well is hopefully a resource to help you think through the risks and benefits, and to be able to talk out loud through the reality of that uncertainty in a safe way, I hope is comforting and helpful.
Thank you. Okay, well, I think we'll wrap things up. Great job, guys. Thank you so much.
Thanks, everyone.
Thank you.
If you continue to have questions, just feel free to ask them in our comment section and we'll do our best to get you an answer. Thank you so much.